All right, there's our timer at our 5 minute break, and we're ready to start again. I'm really excited to introduce our next mentor. Sandra and I actually went to high school together, and she has spent her entire career in healthcare. And she's going to tell you all about it. But Sandra and I actually worked together as well, because years ago I used to work on the nursing floor as what we called an administrative health clerk. So there's a whole other type of position within healthcare that we don't hear about very often are health clerks or ward clerks. So Sandra Hatch is newly retired, I should mention, which is super exciting. So Sandra, tell us your story.
Thanks, Brenda. Yes, I span back quite a few years, 35 years I've been working, and things have changed a great deal, such as I'm, presenting or talking to people that I can't even see. So that presents a little bit of a challenge. I'm used to getting feedback from people. So if I slip into my hospital jargon, Brenda, I'll count on you to kind of ask me to clarify because I sometimes will do that. So
I'll do that.
so nursing, don't even know where to begin. I think you could talk to 10 nurses and you would get 10 different stories of how their careers developed and what they did and how they feel about it. And certainly mine has been, I've been done a little bit of everything. I've done most of my career, spent most of my career in rural nursing, and I'll kind of talk a little bit about that. But I started off with a 2-year diploma program, which was very common in the 80s when I graduated. And I later went back and did my degree through distance education. Still very different from the distance education that's done today, which is mostly virtual. I still had to sometimes go into the university and that sort of thing. But I started my career off actually in Victoria, British Columbia, although I had gone to school and I'm from Nova Scotia. I got married and my husband was in the Navy, and so we had a posting to British Columbia, which we absolutely loved. And I totally loved nursing there. It was very different than the kind of nursing that I had experienced here. And so that was an opportunity for me to really try that type of nursing before I came back to Nova Scotia. And when I did come back a couple of years later, that kind of more we had individual patient assignments rather than being a team of nurses providing care to the whole unit. I would have had my 6 or 7 patients that I was solely responsible for. So I came back to Nova Scotia. I worked in the city at the Victoria General for a little while. Jobs were scarce. Full-time jobs were really scarce in the late 80s, and I was lucky enough to get one. Unfortunately, I didn't stay there all that long. I had come from a place where the group dynamics were amazing and incredible, and the group of nurses in Victoria supported each other in such a way that I searched for that for quite some time, and it was a little while before I found it again. I certainly didn't find it at the VG, and I left there. I'm sure the rest of them felt fine, but I was only 20 and I was still kind of feeling out what I wanted, and that wasn't the type of nursing or the type of environment I wanted to be in. So nursing's dynamic, you can move around, so I did. And I went to the delivery room because for me to be a nurse, I partly chose that because I wanted to do some practical skills. I wanted to do something in my career that I could apply to my life. And certainly working in the case room or the delivery room was very practical. And it has served me at least 2 times, actually many more, while I supported lots of my laboring friends and family members. So I went there until really the baby bug kind of bit me, and I knew I wanted to start thinking about having a family. My husband was in the Navy, was away a lot, didn't have any support in the city, no family in there. So we decided that if I could get a job in my home community, that we would move there, and that would mean my husband would travel, and he did for 25 years to the city to work an hour and a half each way. So a bit of a commitment for him. However, for me, rural nursing, I thought I had a lot of skills because I'd worked in 3 different places and they were all very different. But I came rurally and worked with some really fabulous nurses who had really been innovative and creative and were really independent thinkers and were accustomed to making really good decisions. And I really found my niche there, and I really, I feel like I really blossomed, and I learned so much. It was such a great place to work. I spent 10 years working on the nursing floor. Then I spent 10 years as what you might think of as a head nurse. Then I spent some time, I went back to school. I thought I would become a nurse practitioner. That was just starting to come out. And in the meantime, I had gone back to university and done my degree. So I kind of upgraded my skills, so to speak. The nurse practitioner program was fabulous, but I was at a point in my life, I still had children in school. My husband got out of the Navy that year and got a new job where he was actually away more. My dog was dying. It was just a really, really busy year. And I was working 50% of the time. So I was going into the city, driving that hour and a half, well, almost 2 hours to Dal 3 days a week. I was working every weekend, and I burnt myself out. And by by Christmas of that year, when I cried for no reason, whenever somebody talked to me almost, I knew there was something wrong. And so I really sat back and thought, am I going to continue with this? And I just chose not to. And it's not something that I've ever regretted, although my last job is very much in keeping with a lot of the skills that a nurse practitioner would have. So I went on and I taught for Nova Scotia Community College twice. So I taught the NSCC, I taught at the CCA program, or the Continuing Care Assistant program. So those would be the people that you would see most often in nursing homes that are providing the care and doing that sort of work and going into people's homes and providing that care. So I did that. I also worked in home care as a nurse for a while. So I was the nurse going out into homes to deliver some care. I was a care coordinator for a while. So that's the person that goes out and assesses and determines what people need in their home to help them to stay in their home for as long as possible, or help them to transition to long-term care if they need that. What else have I done? Oh, and then my last 4 years I spent as a family practice nurse. And that I worked very closely with the nurse practitioner who worked with us. It was a really dynamic role. It was a new role in the site that I was at. There had never been a family practice nurse before. So they were very excited to have me. I was very excited to be there. A lot of the skills that I had learned in that one semester as a nurse practitioner student, I was able to bring with me and actually utilize, because those are the sorts of things that family practice nurses do. So I had a very independent practice. I saw a lot of babies, did all the baby immunizations on my own and prenatal visits, a lot of other wellness things. And I developed a keen interest in health promotion throughout my whole career. I've been part of several health promotional clinics. And so I continued and I kind of ran with that a little bit and developed some low carb and some of the other trendy things that are happening to try to support people. So I tried to learn more about those things. And luckily, there's some really good clinics in Nova Scotia that are doing some diabetes reversal. And yes, diabetes can be reversed in the right circumstances for the right people. And I was lucky enough to have a couple that people in our practice that actually reversed their diabetes. So that was really exciting for me. So I really enjoyed that. So, but my time kind of had come to an end, and I already had always planned to retire when my date came up, and so I did. And I spent a couple of months that I wasn't working, and now I'm kind of back doing a few little things. Like I have a little special project I'm working on for the site where I used to work. And I still have lots of connections and lots of interest, but I'm looking forward to this new phase of my life and kind of supporting people in different ways and learning different skills. So one thing with nursing, like you're a lifelong learner, and so I'm continuing to learn and do new things. So that's kind of that's a nutshell of what I've done and where I've been. So.
And I really wanted you to do that because I know you've done a lot of different things, but I wasn't sure exactly how it all fit together. So that's amazing. I mean, I think you talked about probably 7 or 8 different health careers that you've done through the years. And nursing is so much more than just, what we think of as a nurse, because there's so many different departments and so many different roles, and there's clinics, and then there's the home nursing. There's so many things now. It's amazing. And I locally here like I can't get a doctor, so I do have a nurse practitioner, and often it's her nurse that I see rather than the actual nurse practitioner. So when you're talking about that role, I fully understand what you're talking about. So that's amazing.
It's a
So what's the
practice
pace?
role.
Sorry, Sandra, what was that?
It's a collaborative practice environment, which is very much the key to the future, right? Because you get the right provider for the right job. You don't always, people think they need to see a doctor, but a lot of the times they don't. And so, yeah, so that's really, really good.
Yeah,
Yeah.
I mean, I haven't seen an actual doctor in years.
Yeah.
So what about the pay scale? Like, what can people
Yeah.
expect to make?
It's really diverse, and it depends upon where you work. But in Nova Scotia, there for registered nurses, there are 9 different levels or um, hmm, salary scales, so to speak. So most staff nurses or nurses that you think about, and even in all of my nursing roles, I worked as an RN too. And that's really the most common. And the pay scale for that is somewhere around 65,000 to about $85,000 a year. If you're an RN9, you can make as much as $95,000 a year. If you're a nurse practitioner, you can make up to about $115,000 a year. Plus, on top of that, there are several incentives. There's a leadership premium and there's an education premium. Generally, when I was working, I would get both of those. So that's another couple of thousand, maybe $2,500 a year. If you hold a national certification with Canadian Nurses Association, which is our national nursing body, then that's another $1,000 a year. And I held that up until 2020. I didn't renew it when I knew I was going to retire. But so there are lots, and then there's opportunities to make overtime. Certainly, I know staff nurses who've made more than $100,000 every single year because they worked overtime.
Wow,
Yeah.
excellent. And I mean, obviously, with the healthcare crisis that we're going through, there's lots of opportunities.
Yes, there are jobs everywhere, and I understand that this year all of the graduates have been promised jobs in Nova Scotia. So it's something that we've always been working on, trying to be more innovative and creative. But our system is big, and sometimes we're not as responsive as we would like to be. But I think that is an area that they're trying to address, and let's hope that they're able to do that. So yeah.
Excellent. So what advice would you give a student who's interested in this career?
I would say be really open. Think about where you want to be and what you want to do and make it happen. I mean, I think that you can. When I think back to myself, when I started, I was only 20 years old when I started nursing. I was working on a unit where it was a women's surgical unit, and all the women were the age of my mother. And it was my first job, and I was not in my home province, and I was scared to death, like every new nurse would be. And I remember thinking, why are these women my mother's age going to listen to me? Why are they going to, we had a lot of teaching that we needed to do. And so I used to go to those more senior nurses and make sure that what I was telling was absolutely right, that I couldn't improve or whatever. And so then I started thinking about how I presented myself and how I did those sorts of things so that I could speak with confidence even when I maybe didn't feel confident. So I think sometimes you just have to go ahead and do it. I think my own fears held me back in the beginning. I mean, I don't know if you would agree, Brenda, but when we graduated, there still were lots of opportunities that didn't include going to university. And there still are now, but I think sometimes for some of these roles, right now, it's only a baccalaureate. You have to have a bachelor's degree in nursing in order to be a nurse. When I started, you didn't have to, because nursing wasn't my first choice. I didn't plan to be a nurse my whole life. It just kind of happened in the last couple of years of school. I always wanted to be a veterinarian. I love animals. I thought that would be perfect. But when I really stopped and thought about me, I didn't want to go to school that long. And I was afraid of university. I didn't think I had what it took, and I didn't think I could do it. But when I went back to university, later on, I did very well. I graduated on the dean's list, so obviously those were probably just my young fears. So I think really, take all the opportunities that you can get. And once you're interested, and it's different than high school. I mean, it's more challenging in some ways, but it's better in other ways. If you're the kind of person that enjoys some autonomy and being on your own, then university, is a place where you can really shine with that.
Excellent. And I mean, I know this one as well, because as you know, my mom was a nurse too, and I know you worked with her.
One of my great mentors, your mom.
Yeah, she was a good nurse, that's for sure. But can you talk a little bit about the work-life balance, especially in rural nursing?
Yeah, work-life balance is is a challenge. It absolutely is in any area of healthcare. It doesn't matter really what you're doing, from housekeeping to working in the kitchen to being a nurse to being a doctor. There's a lot of work-life balance concerns, and so I think it's really it behooves us as individuals. It's our responsibility to make sure we're not working too much. So as a registered nurse, I'm as responsible on hour 12 of a 12-hour shift as I was at hour 0. So if I accept overtime, I have to be able to perform at the same level that I perform at any time during my shift. So you have to be able to say no. So when I was a manager, I used to say to people, they'd sometimes say, "You ask me so much," and I would ask me to work so much extra or whatever. I can't work this much. I said, "It's my job to ask. It's your job to say no. If you can't do it, just say no. It's okay. But I have to ask because I have to fill the shift. That's my job."
Yeah.
Right. So then as a staff nurse, I've often said no, and you have to learn to say no. Sometimes I didn't say no. I can remember I just got home from work one day. We're still working 12-hour shifts, and my good friend, another classmate of ours, a good friend, called me and she said, "I don't have time to talk to you, but I need you to come back to work." And I said, "Okay, be right there." Left, got up, got dressed, had just gone to bed and went back. So you have to know when, I knew that she wouldn't call me if she didn't absolutely need me. So she did. I went in for a couple hours and then I went back home. I went back to work the next day. That didn't happen all the time. So certainly you can work overtime, work extra, but you have to know when to say, "Yeah, no, I've had enough. I can't do anymore." And that's kind of what happened to me in that year that I was doing that nurse practitioner training. I probably shouldn't have worked 50% of the time, but I did, and I just, overdid it. So it was a good lesson for me.
Yeah,
Don't
I think, being in charge of our own kind of mental state is an important piece, and learning to say no is something that you really have to build up to. It's not an easy thing to do, and I think we all need to learn to do it a little bit better.
Absolutely. And I think COVID has taught us that too, as well, right? We think about all the frustrations and the uncertainties of COVID and how that's impacted people's mental health. And I think we've learned kind of to set limits and accept limits in a better way than we did before. And we maybe pushed each other harder than we should have.
For sure. And we know that COVID has greatly affected the healthcare
Absolutely.
system.
Yeah,
Yeah.
for sure. And not, where I worked, because we're in an office setting, there certainly were changes. We went from 100% in-person visits to 0 in-person visits in the very beginning. They were all on the phone. And then now we do a combination. So if I were working, there's a combination, mostly in person, but there's still some on the phone because our practice, folks were a little bit older, let's say. We didn't take on the whole virtual, as in computer and cameras and that sort of thing. But I'm hoping that my replacement, she's young and keen, that she will really drive that forward when she comes. She's on maternity leave, but when she comes back, that would be something, because you get so much more out of a visit if you can see the person and kind of interact with them than you do in the environment where you don't really see, you're just talking on the phone. So yeah.
Very true. Very true. I'm also open to questions in the chat. If any of the teachers or students have any questions, they can put them in the chat and I will make sure Sandra can answer those for us as well. We've got about 2 minutes left and then we're going to go to our next break. So if you have any questions, please put them in there. I just thought of a great question and now it's gone again. See what happens at our age, Sandra? We lose our questions.
I understand that very well.
Yeah. Yeah, we definitely sometimes sometimes lose. Oh, I was going to ask. So most of our students are in grade 9 and 10, and they're picking high school credits or courses. What are some of the Tara just said the exact same one. What courses would you recommend to students who are in high school?
Right. So all academic level class courses. Different universities have slightly different admission criteria. So for Dal and St. FX and CDU, slightly different. So I would check with them to see what courses you need. But certainly you need your sciences, you need your chemistry, you need your math. Um, whatever other sciences might be helpful to you. You know, your biologies could be really helpful, although maybe not be a requirement, but if you could pick those up as an elective if they're not a required course. And yeah, just make sure that you really check with the universities and see what their course requirements are, because they can be different. Yeah, you don't want that to stop you from getting in.
Exactly. And I know a number of people have had to go back and do some upgrading in order to get in.
Absolutely. And so that was not uncommon at all, right? For people to have to go back and do a certain science or that sort of thing. Yeah, for sure.
Excellent. Well, thank you so much, Sandra. It was so great to see you. I mean, I see a little bit what's going on from Facebook, of course, but it's great to see you in person, and maybe we'll get back to hanging out at the beer garden in the summers.
Oh, yes. It's been a while since I've been there, but yes, that could be. So I hope that was helpful and that you got a sense of how dynamic nursing can be, because it can be an incredibly rewarding career.
Excellent. Yeah, I mean, just the number of things that you've done in your career line is amazing, because, you know, again, a lot of people think a nurse is a nurse, but there's so much more to it.
It's not like you see on TV. You don't sit and wait for the doctor to tell you what to do. You've already got 3/4 of those things done by the time he walks in the room.
Exactly. Excellent. Well, thank you so much, Sandra.
All right.
And to our teachers, we're going to take about a 4-minute break. So we're going to set up the timer for everybody so that you're ready to do a break. Thanks, Sandra.
Thanks. Take care. Bye-bye.
Okay, bye-bye now. Excellent.